estimated that there are anywhere from 75 to 100 trillion microscopic cells in the human body. The functions of these cells are everything from providing structure and stability to providing energy and means of reproduction. These cells make you who you are, and you wouldn't be alive without them. But what happens when your body's own immune system is mistakenly fighting off your body's good cells and tissues? WebMD describes an autoimmune disease by saying, instead of protecting your body from infection or disease as it normally does, the immune system attacks and destroys your body's healthy tissue. It does this by producing antibodies that fight off your body's tissue, and this is called autoimmunity. One of the most prevalent autoimmune diseases is called Sjogren's syndrome. In the case of Sjogren's, your body's own white blood cells called lymphocytes are attacking your exocrine glands, specifically your lacrimal glands in your eyes and your salivary glands in your mouth. The inflammation and destruction of these glands decreases the amount of saliva and tears you're able to produce, which causes extreme dryness and discomfort. Sjogren's was discovered in 1933 by Henrik Sjögren. There are currently 4 million people in the U.S. Suffering from this disease, which is why it's one of the most prevalent autoimmune diseases out there. 90% of those affected, you can see my pie chart, 90% of those affected are women are women with an average age of diagnosis of 40. But it can affect any age in both sexes. Researchers believe it's more prevalent in middle-aged women due to our hormones while going through menopause. Sjogren's syndrome is difficult to diagnose because the symptoms mimic other diseases. Almost 50% of the time Sjogren's is diagnosed, it occurs alone. That's referred to as primary Sjogren's. The other half of the time, it occurs with the presence of another autoimmune connective tissue disease, such as rheumatoid arthritis, lupus, or scleroderma, and that's referred to as secondary Sjogren's. The signs and symptoms also vary from person to person. The two main symptoms are dry eyes, which is described as having sand in your eyes, and dry mouth, which is described as having extreme cotton mouth. Other symptoms people can experience include swollen salivary glands, prolonged fatigue, severe joint pain, and skin dryness, and nonspecific rashes. It can also affect your other organs such as your lungs, kidneys, skin, and digestive tract. For some, when their mouth is dry, the mucus thickens and blocks the flow of saliva into your mouth, causing parotiditis, or the inflammation of your parotid gland. I brought a really attractive picture of me from when I had parotiditis last year. At its peak, my cheek was the size of a softball. You can see it. I was diagnosed with Sjogren's syndrome last February. It took about a year for the doctors to realize that my 6-month-long stretch of sinus infections and parotiditis probably wasn't something they should ignore, and that there was something else going on. If you're like me and have some of these symptoms, your physician will want to do a few blood tests to see if your antibodies are elevated, a few eye tests, and test your saliva production. Some of the blood tests include your anti-nuclear antibody test, your rheumatoid factor test, your ESR test, and an immunoglobulin test. Your ophthalmologic tests are the Schmier test, which measures your tear production, and your Rose-Bangle test, which is when a specialist drops dye into your eye to view the outside of your eye and look for dry spots. Your dentist can also check for an increased amount of dental decay due to a lack of saliva. The decreased production of saliva is associated with Sjogren's. The decreased production of saliva associated with Sjogren's creates an ideal environment for bacteria, which causes cavities. If some of these tests come back positive, it is crucial to see a rheumatologist because they are the doctors that specialize in autoimmune disorders. Since there is no known cure, it is thought that Sjogren's syndrome is due to genetic and environmental factors. Researchers say that sufferers appear to have specific genes that make them more predisposed to become affected, and the onset of the disease is related to some sort of trigger infection, viral or bacterial. Early diagnosis is really important in preventing further complications and to figure out the best treatment plan. Most of the treatments for Sjogren's are aimed to relieve the symptoms of dry eyes and dry mouth, and preventing and treating prolonged complications such as infection or dental disease. Prescription medicines for dry mouth and dry eyes are available, but there are a number of over-the-counter products that may alleviate these problems. Using sugar-free gum and sweets to promote salivary flow or tear substitutes are also recommended. All patients should receive regular dental care, and patients with extreme dry eyes should regularly see an ophthalmologist to check if there's any damage to their cornea. If there's another associated autoimmune disease, doctors can prescribe antimalarials, anti-inflammatories, or immunosuppressants. Unfortunately, because all the symptoms are not always present at the same time, Sjogren's can involve several body systems. Physicians, eye care providers, and dentists sometimes treat each symptom individually instead of realizing that there's a systemic disease present. Once diagnosed, it's important to prevent further complications and figure out the best treatment plan for your specific symptoms. Even though there is no known cure, people with Sjogren's are able to live normal lives with the help of medication. Here's a handout that I've provided that explains a little bit more in detail about the disease, the symptoms, and the types of treatment to hopefully answer any questions you might have. Thank you.